Hello, friends. Welcome back to another episode of the Save Yourself podcast. I hope you have checked out the new chai latte, the new chai protein. We actually have stick packs, travel packs for the chai latte, which are super popular right now because you can take it with you. It has a very unique mix. It's super creamy, so great for an afternoon snack when you're craving something. So actually drinking something warm can really help you with afternoon cravings. It's coconut milk based. It's delicious. It's so much healthier, real food, made in a great facility, tested for heavy metals. That's over at amymdwellness.com. I hope you'll check out our new retreat that we are doing on September 19th and 20th. We're super, super excited about that. The retreat starts at about noon on the 19th. We are going to go deep into all the topics of mind, body, wellness from like basically morning to night. There is yoga. There's going to be swimming. There's going to be good food. There will be beautiful resort. There's going to be a white party on Thursday night. All of that information is also available at amymdwellness.com. Now let's talk about today's interview. I am so super excited to have Dr. Mary Claire Haver on. If you have not seen her growth on social media, you should check it out. She's on TikTok and on Instagram and many other places. But she really took this movement of menopause and I think, really single-handedly made it a bigger movement than I think there was a groundswell, and she kind of took it to the next level. Every day she would show up with new articles about the menopause journey, and she's really ignited a lot of interest around menopause. I'm very excited to talk to her because honestly, I think that most people think of menopause as this like very sad, negative thing. And what I've realized is that, I concentrate more on perimenopause, all the years before menopause, but that it can be a really beautiful time in your life. So super excited to have her on and talk all things menopause. Dr. Mary Claire Haver, MD, is a board certified obstetrics and gynecology specialist, a certified menopause practitioner. She is a culinary medicine specialist. She's a passionate entrepreneur, best-selling author. She focuses on women's health. She graduated from Louisiana State University Medical Center, and she completed OBGYN residency at the University of Texas Medical Branch, UTMB. As her patient population grew older, she wanted to concentrate on menopause. She started the Mary Claire Wellness Clinic in 2021. She recently had a best-selling, really, really popular book called The New Menopause, and we're going to talk a lot about that. So I'm excited for you to feel empowered and get a lot of information from this. Thank you so much for watching and listening to the Save Yourself podcast. I have the America's menopause female doctor. I don't know what is the official queen name for you. Dr. Mary Claire Haver, thank you so much for being on. I'm so honored to have you here so that we can talk all things menopause and really help women navigate through this crazy time. And I know a lot of people already know you, but for those of you who don't know you, would you do a brief intro?
So my name is Dr. Mary Claire Haver. I'm board certified in obstetrics and gynecology. And for about 20 years, I had a pretty traditional generalist OBGYN track in academic medicine. So I taught residents and med students, and I saw patients. And then I started getting really interested in menopause as I was going through it, and my patients were aging with me, and more of them were going through it. And I realized there was just huge gaps in my own knowledge and education around menopause care. I got interested in, what can we do different with nutrition and lifestyle, and that kind of like that was my toe in the water in the menopause space. But then, as I discussed that more and more, people wanted to know, well, what about my ringing in the ears, and what about all these weird symptoms I'm having? And that led me to kind of do these deeper dives into the literature and finding all these correlations that are actually out there, but it's not being talked about publicly. And not being taught in our training programs. And so it really just drove my passion to educate, as many people as possible. And for me, fortunately, it's turned into a pretty large social media following. So I just get so excited every morning to get up and research articles and then share what I
I
learn with
love
the world.
that. Let me ask you this. I mean, I've probably followed you for a while, but when
Mhm.
was and I think it's because we have some common mutual,
Mhm.
people, but when did you really start doing the
The
education piece of this?
the turning point for me was probably around 2015. At the
Okay.
end of 2015, my second oldest brother passed away. My oldest brother died when I was 9 from
Oh, I'm
leukemia.
sorry.
So, but my second brother Bob's death, really kind of it I stopped taking birth control pills. I was 48. I just got kind of lost my mind for a minute through grief and realized I was fully menopausal. Like I had gone through menopause and I had no idea. And so that's kind of when like I started have to think about things differently. I was gaining weight, I wasn't sleeping,
Yeah.
I was having all these weird symptoms outside of just the hot flashes.
Yeah.
And so like 2016, 2017, I started kind of putting a toe in the water on social media just for fun. I'm still
Yeah.
seeing clinic, still like full-time OB-GYN, seeing clinic,
Yeah.
delivering babies. And, but then I just realized that there was such a hunger for this information. So, and I like a good dopamine hit as much as anyone. So, you get all these views and you're like, okay, let me go answer these questions. So,
Yeah.
really, my growth took off, on Facebook first. And then during COVID, as many of us, I started playing around on TikTok and that really exploded. And then Instagram has really, in the last couple of years, been my biggest, where I'm doing the most education,
Love
and
it.
seem to be hitting the most, people in a positive way.
The one question I had for you, I heard you say something, I think it was about the new book. The New Menopause is your new
Mhm.
book, and it's such a wonderful guide for women. What is the old menopause and why
Yeah.
new menopause?
So the old menopause, I think there's kind of an old guard in the menopause space. And it's centered around that menopause really is only hot flashes. And it's centered around you should accept your fate. And there's really not much you can do. This is just something women go through at this age. And we're only going to consider treatment if you're having the most severe symptoms because there doesn't seem to be any benefit for you long term. That's really kind of the old guard. And that caveat of it's all in her head and women tend to somaticize their psychological symptoms.
Hmm.
There's always this like, let's not really believe her when she says what's going on. And let's just, she's probably anxious or she's tired. This is just that time of life. And I think that that's just all absolute trash. And
Yeah.
that we need to start believing women, meeting them where they are, and realizing what the effects of all of these hormone changes we're going through from perimenopause, the zone of chaos, to complete depletion of estrogen, progesterone, estradiol and progesterone in postmenopause, and how that truly affects every organ system of our body. That's the new menopause. Is look, not I'm not here to sell anyone HRT. That is a personal decision between a woman and her clinician. I'm here to make sure that she's having an informed conversation and she's making a decision based on facts and not fear.
Yeah, and I think that's needs to be said because I think some people think, well, don't sensationalize, hormone therapy. But I think what you do is really well is really tell people, hey, this is what's happening during menopause. This is what estrogen does. This is the potential for people with, using hormone therapy. And yes, there's always two sides to every story, right? Like
Mhm.
I think but the side of the story that I always knew during my training years was like, don't use hormone therapy.
Mhm.
It causes breast cancer. And I think that that's something that most people still remember.
Right. I think we have a whole generation of clinicians, myself included. My last year of my residency training was when the Women's Health Initiative
Yeah,
results were just, exploded and just completely decimated the care of a woman after fertility.
I know. I mean,
And,
it's crazy.
I mean, Dr. Shaw, it's so much bigger than us.
Yeah.
There's a gender health gap here
Yeah.
that the underbelly is really getting exposed. It's not just menopause care. It's like, why is the bulk of funding in women's health going to fertility and reproduction? Not that that's not important, but
Yeah.
we're getting like slivers of research funding and dollars going into the last third of our lives. Why are there very few studies that incorporate women who are hormonal? It is harder to study us because, yes, we have hormones that fluctuate and we aren't steady state. But that's leading to us having more medication failures, poorer outcomes in our male counterparts, us living 20% of our lives than poorer health than our age matched males. And that's what I'm standing up for. Like, this is not okay. And I deserve in this part of my life after reproduction to have the healthiest part of my life. Why not?
Right. And explain to people, a lot of people don't even realize how do you even know if you're in perimenopause or
Mhm.
menopause?
That's a
I think
great
that's a
question.
common question.
It's
Yeah.
a common question. Um, so let's go back to a little bit of, explain what those things are and then what the symptoms might be. So someone, a little flag might raise up in her head. So we females are born with all of our egg supply, very different than males. Males, once, we all kind of are born with our, what we call our gametes and our germ
Mhm.
cells. And men continue to make their supply fresh every day. It does slow down as they get older, but they can potentially father a child for the rest of their lives.
Yeah.
Females are born with all of our eggs and it lasts us our entire life, which is, until we are fully menopausal. So we're born with about 1 to 2 million eggs. And then by the time we're 30, we're down to about 10% of our egg supply, roughly about 120,000 eggs. And then by the time we're 40, we're down to 3%. Menopause, full menopause represents you're out of eggs, you're done.
Mhm.
And we can't make any more. We haven't figured out how to do it yet. So perimenopause is when, if we think about a normal reproductive cycle in a healthy woman, we have this very predictable ebb and flow of hormones of FSH, LH, estradiol,
Mhm.
progesterone. Testosterone kind of hangs in there
Mhm.
fairly stable. It does kind of ebb and flow, but not like estrogen. So that all happens because you and I know there's glands in our brain, the pituitary and the hypothalamus, that are sending signals. The hypothalamus talks to the pituitary sends FH and LSH to the follicles to say, hey, let's ovulate, let's get those estrogen levels up. We reach a critical threshold in perimenopause where we cannot respond to those same signals the same way. So what happens is everything happens to normal in the brain. The signals go out, and the ovary's
Mhm.
like, I just don't have enough
Yeah.
juice left. I
Yeah.
can't get this going. Hypothalamus gets mad because he's waiting on
Mhm.
on estradiol to rise. Says, hey, pituitary, send more. So we get these increases of FSH way higher than we ever had in pre-menopause. Finally, the ovary's like, okay, great, fine, I'll get this egg out. So it's delayed. Then, because we have the surge of FSH, we have a much higher rise in our estradiol level than we ever had before. And then progesterone, we do ovulate occasionally. And then the progesterone never quite gets to where it was as it was in premenopause. So what used to be this very EKG like rise and
Mhm. Mhm.
fall of these beautiful hormones now becomes a chaotic zone. You don't know when it's coming, when it's dropping, who's coming
Yeah.
next,
Mhm.
how long's the delay going to be. So, what does that look like symptomatically? Well, let's start at the head. So, the brain loves predictability. The brain loves to know what hormones are coming when they come.
Mhm.
And when they become so sporadic and when we get these crazy rise and falls, we see cognition changes in the form of brain fog. We see mental health, so 40% increased risk of depression and anxiety. Okay, mostly due to the neurotransmitter disruption caused by the fluctuating hormones. It's a direct feedback. So, palpitations, it's a known vasomotor symptoms. Of course, hot flashes. 90% of us will have abnormal uterine bleeding or cycle disruption. Gut microbiome, you talk about this all the
Mhm.
time. Totally disrupted, completely dependent on estrogen. Also, we have an estrovolome, which is the part of
Mhm.
the gut microbiome that recirculates estrogen. That it's part of the metabolic breakdown. That becomes disrupted. So we're not processing estrogen in the same way that we used to. Joint, muscle,
Mhm.
skin, bone. I mean, everything is affected, our genital urinary system.
Mhm.
So, where my symptoms were hot flashes, weird hip and back pain, without injury, and, brain fog, you may have frozen shoulder,
Mhm.
nausea, bloating,
Itching.
and
Yeah. Yeah. That I think that and age range, I think that's really confusing for women.
yes.
So, they'll say to me I had a conversation with my cousin, and she's in her 40s, and I said to her, "Blah, blah, blah, perimenopause, nobody teaches us how to eat in perimenopause and blah, blah." And she's like, "Oh, but I'm not in perimenopause yet." And I was like, "What do you mean?" And she's like, "Well, I nobody told me I'm in perimenopause." And I'm like, "No, you're in perimenopause." So explain to people,
Sure.
how they might know.
Okay, so average age of menopause, so no more eggs, no more periods, is 51. Okay, but under the normal curve, 95th percentile on either side is 45 to 55. Perimenopause, remember, you're running out of eggs and things aren't responding the same, is 7 to 10 years before the final menstrual period when you start becoming symptomatic. So it's completely reasonable for a 35 to 45-year-old woman to begin noticing, and it's universal. Something's not right.
Mm-hmm.
We're not
Exactly.
teaching people how to recognize kind of the non-cliche symptoms of menopause and so of hormone
Yeah.
changes. And so she's like, something's not right. I don't
Yeah.
understand. Like, I'm not eating the same. Or I'm doing all the things the same, but
Hmm.
my body's changing.
Yes. I think the sleep disturbances, the muscle, like, oh, I'm not able to have the same body composition. I don't
Hmm.
think people realize the muscle loss that happens during that time. I think there's so many weird symptoms, like you said. I mean, there's like, I would say over 50 symptoms, if not 100
Hmm.
of different things that could be happening to your body. So I guess a lot of people ask me, and I think you're the expert on this. How do you know when you need to talk to your provider, your doctor about hormone therapy?
So, one, make sure you're finding an informed provider.
Mhm,
Unfortunately, right now, if you just play the lottery and walk into even an OBGYN like me,
mhm,
office, you only have about a 10% chance right now of being able to have an informed conversation. This is not the fault of the physician. This is the fault of how we train our clinicians
mhm.
and how we don't value menopause and menopause care. So, one, you need to make sure you're walking into an office with someone who knows what they're talking about because you're going to get dismissed. It's almost 90% of you will be automatically categorically dismissed and not offered any treatment whatsoever, or at best an antidepressant. Um, so, one, something, certainly if you're having menstrual cycle, if it's absolutely clear you're having hot flashes, you're having menstrual cycle disruption, but even if you can't put your finger on it and something's not right, and one of the first hallmarks in perimenopause can be 40% of us mental health
Mhm,
changes.
mhm.
New onset of, you're suddenly anxious or irritable, and it's not just one day. This is a new pattern that's developing. That's one reason to go. Any cycle disruptions, you should go immediately, get that evaluated. Um, if you're having body composition changes, you've changed nothing in your diet and exercise, and all of a sudden you're gaining weight and your waist is getting wider. That's usually from visceral fat deposition. That is a bell ringer for ensuing cardiometabolic disease.
Mhm.
We need to get you in and start discussing not only hormone therapy but nutrition, exercise changes, and things that need to happen to decrease your long-term risk.
What do you think about, somebody was talking about microdosing, things like GLP-1 agonists during, menopause? I had never heard of that before.
um
Um,
for menopause, it's not going to extend
yeah,
the life of your ovary.
I know, I was
but
like, I didn't
But
know.
the data, the latest study I saw was looking at women who were fully menopausal and obese. One group was on HRT plus GLP-1,
Mhm.
and they were on semaglutide, and the other group was on just semaglutide, no HRT. And the women on both combined lost 30% more weight. Now, I
Wow.
don't know what their body composition changes were, so I'm not, if they were just looking at the number on the scale, which is not my favorite way to monitor those things,
Yeah,
but they did lose 30% more weight with the combined therapy. And no one
right.
in the menopause space is surprised by that fact.
Yeah, I think it makes sense, right? Because of all the changes that are happening with estrogen and progesterone, your microbiome and the muscle loss. If you could counteract that a little bit by, slowing digestion, calming the hunger, like ghrelin goes
Cues.
up during
Hmm.
menopause and perimenopause.
Yeah.
So calming that makes sense, especially for those who have really high risk factors for cardiometabolic diseases. I think it could be an interesting new world there. Let's talk about the new menopause book. I think that this is something that has, first of all, congratulations. It
Thank
has
you.
done so amazing.
Hmm.
Tell us a little bit of behind the scenes because we love to hear some behind the scenes. Well, how did you think of this concept? How has
Hmm.
it been, the experience? Share whatever you can, kind of maybe something that people don't necessarily hear about you.
It really was driven by my followers. The all of the little things that I was discovering and getting so excited about every morning about, tinnitus and menopause, or vertigo and menopause, or palpitations and menopause, or blood pressure or cholesterol or lipids, and, on and on and on. And I'd make all these videos and write blogs. And finally people were like, can you just put it in one place? Because I'm
Love it.
chasing you all over the internet to try to
Yeah.
find, I remember you said something about this. And I wanted to be, so we were actually in Colorado hiking, my husband and I, and the Galveston diet had been published, and it was doing well.
Yeah.
But I was really feeling compelled because of social media to talk more about menopause in general. And we were hiking. He's like, you should write another book, and it should be about menopause. You need to write, a modern, something that the layperson can read, that is like modern menopause care and like
Yeah.
how we got to where we have been. I
Yeah.
wanted to do some of the history so people would understand why so many doctors say what they say, and why there's so much misinformation, and dispelling the aftermath of the WHI, and then really giving them not just hormone therapy. I mean, that's just one tool in your toolkit, but like, how could you address all these symptoms using nutrition, exercise, stress reduction, other, what do we know works in these things that women are suffering from? And it was just the most fun I've ever had. I took 4 months off. I'd been like collecting research
Yeah.
articles, and I just every day would get up, go hike if the weather was good. We were here in Colorado, and sit down all afternoon and just pound it out.
Oh my gosh.
And it was
He
this
helped you with it?
really creaky. My husband fed me.
I love that.
He's an engineer, not a researcher, but
Okay.
I would look up and there'd be food.
Oh my
So he
God, how
kept me
amazing.
fed, and then I would meet with my collaborator,
Yeah.
and we would kind of go through it together. And then the editing.
Yeah, yeah,
You've done some great books,
yeah,
and so all that editing process. But it was really the best time I've ever had in my life, because of I just felt like this is what I want to say. This is the legacy I want to leave behind. I
yeah.
really think this is going to help women lead a longer, healthier life and not end up in a nursing home, you know,
Ah,
or limit that time. So it's more than getting rid of hot flashes, which is important. This is setting a course where you're going to need as little long-term care as possible. You're going to have strong muscles and a strong brain and strong bones, and a strong heart, so that you can like live this beautiful last third of your life.
no, I love that. How did you feel when the reception was or like about once you launched it into the world?
So, my I made my husband take me away. So we went to Mexico
Oh,
for the
nice.
weekend, or like we were there. I think we landed on Sunday, and so that comes out on Wednesday.
Okay.
The New
Yeah,
York
yeah,
Times.
yeah,
And I was telling my team, I don't want to know, I don't care. I'm so
yeah.
glad it's out into the world. And so then my friends, the Holderness family, they wrote
Oh, yeah,
ADHD is
yeah,
awesome. So we were publishing on the same day, and we were cheering each other on and supporting each other's books, even though we knew
yeah.
we'd be in the same category. And so she texted me with the rankings, and I was
Aw,
crying in the middle of we were sitting there drinking margaritas. I was like
aw,
bawling my eyes out
so
there, but it was
special.
good because it was just he and I, and it was peaceful,
Yeah,
and it was so beautiful that my friend told me, and
yes.
they were number 2 and we were number 1, and that we
Amazing.
could celebrate together.
Did you have a really whirlwind I know you've written so many books, but is your
Just 2,
launch period Oh, yeah, 2 before this one? Okay.
just 1
Uh,
before this one. Yeah,
oh,
this is my
this is
second
your
book.
second book.
Mhm.
Okay,
Mhm.
I didn't know that. I thought
Mhm.
you had one
Mhm.
before Galveston died.
Mhm.
Okay. So
Mhm.
did you, do the same kind of launch process? Was it like lots of events, lots of, whirlwind, and then you kinda needed that break?
Great question. For the first book, I hired a PR firm. I
Yeah.
kind of checked the boxes people told me to do. And I really felt like a lot of that was a waste of money, that I was my own best PR agent and that I could do it on my own. But the next book, so there were
Yeah.
things that I was like, I'm going to get it on as many podcasts I want to talk about it with as many people who will allow me to discuss menopause on.
Yeah.
So I did that, and really did a lot of that on my own, and the publishing team helped with that as well from my publisher. Um, I was able, Mel Robbins, and
Yeah.
the bigger podcasts that kind of happened for that one. And I just really took my followers along with me in the journey of getting my first copy of the book and it going on sale,
Yeah.
pre-order, and how exciting that was, and really kind of walked them through all the podcasts with me and took them backstage and behind the scenes for all the stuff. And it was pretty amazing. Now what I'm getting to do is I'm lecturing to medical students and residents, like
So great.
all over the US. Actually, I just did one in Canada this week. And
Love that.
that to me is the most important thing that's come out of all of this, is really being able to push the education component so that the next generation of healthcare of clinicians will be menopause educated. My daughter's a second year medical student right now.
Oh,
So
amazing. Is she
yeah,
does she wanna go into this world or what?
OB/GYN, no.
Okay.
She kind of grew up watching mom have really, crazy hours, and
Yeah.
she's very focused on what she wants for her lifestyle, and, like, she's thinking more maybe psychiatry or internal medicine or something. But, she's just a second year, and she did IM, like, elective this summer and absolutely loved it.
Oh,
So,
internal
but she loves
medicine.
women's health. She just doesn't wanna go through an
Yes.
OB/GYN resident to take care
Yeah.
of females.
I think
So
I can relate to her. I think I was the
mhm,
same way. I think I had the most, they call it, I forgot what they called it. Like, so it was like the worst rotations, right? In med school, when you had to do your OB/GYN rotations, it was like you had to stay up all night. And then
mhm,
um, they were sometimes really mean to the med students in the location that I was at. And, I thought to myself, and it wasn't that I didn't want to do the work, but I didn't want to become one of those toxic people that I
mhm.
was working with. And I just saw in their faces, and they're beautiful women that were so smart, but they were just in this toxic workplace. And a lot of them were trying to balance their own lives with
Right.
incredible number of hours. And in that moment, I was like, I don't want to be that person. I love this topic. I love women's health, but I think probably you had some of those. You've probably experienced, that toxic workplace experience at some point in
Mhm.
your either
Of
training career
course.
or after. How is that, by the way? I know things like, um, when I talk to my OBGYN friends, they really do talk about kind of that lifestyle that they had to lead that was really, really, really difficult, especially if you have little kids. Do you remember that? And what was that like? Do you look fondly on it?
Yes and no. I mean, I
Yeah.
honestly, if babies still only came between the hours of 8 and 5, and
Yeah.
then I could go home and be a normal person, then I would probably still be doing obstetrics. And super proud of the work I did for 20 years, but I could not sustain that lifestyle and stay married and stay a decent parent and fulfill my own dreams. I was giving
Yeah.
up years of my life from stress and loss of sleep and cortisol and all the things, because you live in fight or flight the whole time,
Yeah.
you know? And some people love that adrenaline. And when I was younger, it wasn't that bad. But I think about, and my daughter's sitting across from me, and I'm going to cry, but
Aw. Aw.
I think about Maddie, who's 20, and I don't remember her being a toddler.
Mhm.
I just have so few, like, she was the second baby. I was in a new practice that was like go, go, go. We covered 3 hospitals. I was always in the car. And I like struggled to remember like little precious moments with her as a baby. And,
I have
that
the
was my
chills.
choice. I could have walked away from that job, but, it's just beat into us that you signed up for this. This is the job. This is what is required. And I'm like, there's a better way. The burnout rate is terrible. And I absolutely burned out on obstetrics, and walked away from the hospital with zero compunction, knowing I was opening a menopause clinic and I was going to go serve that population.
Mm.
But honestly, when I opened my clinic, I didn't know if they'd be financially successful. I didn't know if anybody would care or come. And turns out, yes, we're very I'm hiring anybody. We're hiring more
Anyone,
providers
where are you based? Where can
outside
people
of Houston,
do
in
you see
Galveston.
patients virtually and in person or
We
just
have virtual options as well as in person, but even if it's virtual, we're licensed in Texas. So,
okay, yeah, so you'd have to
yeah.
be,
Mhm.
a Texas-based resident. Yeah, I
Yeah.
think that's, medicine is so weird because I think it's one of the only things where you have to only practice in the state you're licensed in. I always thought that was such a weird thing because, I mean, they were a little bit lax during pandemic, but it's back
Mhm.
to being really strict, and I think it's not fair because if you have a follower, say, that lives in New York and they really wanna come see you, it's a shame that,
They
um
fly.
Yeah, that they have
It's
to come.
crazy.
Yeah.
And so my next like big goal is to develop a training program for
Mhm.
clinicians so that I
Yeah.
can just teach what I know. And then, I can't see all the patients. That is not my
Do you
goal
see
ever.
patients?
Oh yeah. Yeah.
Okay. So
Yeah.
what's your life like right now?
So right now, this summer, I'm doing PR for the book and taking some
Yeah.
time off from all
Mhm.
the push.
Yeah.
And then in the fall, I will be back. I have two nurse practitioners that are kind of running things while I'm gone,
Got it.
but I'm
Mhm.
still overseeing
Yeah.
while I'm in town while I'm doing the PR stuff. So in October, I'm going back to real life.
Got it. Yeah.
Um, I see patients 2 3 days a week,
Okay.
and we have an hour with each patient because I stepped out away from the insurance model. And so we
Yeah.
take an hour and it's just this beautiful experience. They get to unpack all their menopause trauma. And then because I have an in body scanner, I can do their muscle mass and their visceral fat, and I can really give them a nutrition, exercise recommendations, pharmacology, like the full package.
I love that.
Um,
I love to hear the behind the scenes because it's stuff that I would have asked you off air, but then I was like, actually, I'm just going to ask you in when we're talking because I'm sure lots of people are probably wondering like, what are you doing? Like, what does your day look like?
mhm.
Um, and what do you do for workouts and nutrition? By the way,
Oh, yeah, sure. So, I have clinic days and then I have work from home days, like most
yeah,
of us do now. And so, clinic days, it's a little more packed in. I try to get my workout done in the morning or it's a rest day. Um,
okay,
and then on work from home days, I have a home gym and I have switched. I mean, I grew up doing only cardio. That
yeah,
was my
me too.
jam. I did
Mhm.
aerobics. I worked out to be thin. That's all I
Yeah,
knew.
yeah,
Thin was healthy. And I'm naturally kind of skinny. So
yeah,
that's, I probably ate away at my bone and muscle
mhm.
strength. Um, so now I work with a trainer who develops like muscle, like progressive load resistance training. So now I'm working out like my husband. Like over 30 years together, we've built out a gym. We give each other equipment
Yeah.
for for holidays and stuff. And so now I'm on the bench press
I
instead of
love
just
that.
on the treadmill. And I'm a big fan of the weighted vest,
Mhm.
and I do a lot of work on my computer on my treadmill. So I set up a
Yeah.
little walking desk and I put my weighted vest on. I set it on an incline and I just walk really slow and I can get a lot of research done that way. Um, but like 3 days a week, 4 days a week, I'm doing serious resistance training. So
Yeah.
to
3 to
try
4 days a week.
to,
Okay.
yeah. And then my goal is 150 minutes of cardio a week, mostly in zone two. I'll do a few
Mhm.
sprints here and there. And
Mhm.
I hike so much in the summer when we're in
Yeah.
the mountains that's my VO2 stuff. So I think I have
Y
everything covered.
Okay,
And
so
then,
tell us about the nutrition, and
okay.
then I
So
wanna hear more
nutrition,
about
I really, here's like the truth. When I started, 2015, and I was freaked out about the scale and how lumpy I was looking in the middle, that's where the Galveston diet was born. And really the initial push for me was get the weight off. I
Yeah.
wasn't thinking muscle mass. I didn't know about visceral fat back then. And I kind of learned as I went along. Now I'm 40, I'll be 40, 56. God, next month.
You look so
and
young.
it's the filter. And so the my whole focus has changed. So now I look at my plate and it's protein and plants.
Yeah.
So I'm
Yeah.
trying to get fiber. Like my big goals for the day are to get my 100 grams of protein in and at least, 30 grams of fiber in per
Mhm.
day. And
Yeah.
everything else is just kind of gravy because just focusing on that. And I'm eating so many fruits and vegetables and plants, And the other cool thing is Zoe Nutrition taught me this little trick.
Mhm.
Um, Try to get 30 different plants a week. And
Yes.
so I keep a little notes app on my phone and I try to say, "Oh, look, I got some cilantro or, I
Yes.
got
Yes,
spinach or radicchio."
spices, herbs, nuts, and seeds count, which makes it so
Yeah,
much easier
so
to
much easier.
yeah,
So
yeah.
I'm like all proud of myself. So what used to be a place of restriction is now like, can I get this all in a day?
Yeah, love that.
And I actually weigh more now than I did back when I freaked out for Galveston diet, but I have more muscle mass. I
Yeah,
have a body
yeah,
composition scanner. I don't freak out and I feel amazing, you know?
yeah. Do you have a body composition scanner at home?
So I have one in the office.
Oh,
I
okay.
have the in-body, like, medical
Yeah,
grade, but I do have
yeah.
the little, So I experimented. I tried the InBody, it makes the home scanner,
Yeah.
and it's pretty good. And then I did, what was the other scanner? Hume, Hume,
Yeah.
where it'll
That's what I
do,
was
and I,
wondering if you have a nice home one that you like.
so the InBody new, they're pricey. So the
Yeah.
Hume is only $99. And if that's
Yeah.
you can afford, fine. It's fine.
Yeah.
Because you're not
Yeah.
really like, it's not absolute, you're just looking for
Yeah.
change.
Yeah.
So for $99, I think it's worth it. If you really, if you're going on a GLP-1, you really want to track muscle mass, I would go with the InBody.
Yeah.
It's going to give you better, just more accurate data there. Um, so that's what I recommend to my patients. And then I have like the master one in clinic that does 9,000 different measurements and everything.
Love it. Okay, I have a question. And how do you deal with kind of the hate and the negativity on social media? I think that's something that we probably both experience a little bit
Mhm.
of, but I'm sure I'm curious about your take and how you navigate all that.
So from lay people, I get very little hate. I get mostly, thank you, you're saving my life. You've given me tools, you've given me power, you've given me back my
Yes.
life, wonderful. Where I'm getting some pushback is the old guard of menopause. And I
Mm,
think that, to be honest, and I would probably have to do some self reflection, is that they were used to controlling the narrative around menopause for a long time and them being the only voices. And now that the menopause is kind of growing and there's,
yeah.
actual clinicians who are using evidence and data, and all we want is the best health for everyone. We don't
Mhm.
care,
Yeah.
like,
Yeah. What,
and
yeah.
that is, it gets painful, but it does allow me to like look at my message again. Where did I, where can the holes be poked? What
Mhm.
evidence more evidence do I need? Has the evidence changed? That's
Yeah.
another thing. Things that I said in 2015, I've totally changed my message,
Yeah.
especially in the nutrition area, just because we're learning more and more, and people are actually starting to study women's bodies now. And so, look, what I say today might completely change in 10 years. I hope it will as we get better and better information.
Yeah, I love that. And I think that with anything, especially when you start to get attention and you start to grow, I think there's always going to be people who are going to find things that are wrong with you. It's like that's the culture of growing nowadays, or probably it's been around for thousands of years. But it's nice that you have a pretty good attitude. And do you have any ways to kind of deal with all of the good and bad that comes? Self-care, what is your like go-to
Oh,
self-care
yeah.
things?
So I was, in that OBGYN doctor mindset. I had zero self care. It was get up, go to
Yeah.
work, come home, try to be a mother and stay married,
Yeah.
and then my daughters became teenagers and everything hit the fan,
Mhm.
typical teenage stuff.
Mhm.
And I don't know if you're going through that, and I see
Yeah,
your
my kids
daughter.
are just started. My kids are
So
teenagers now. I have a 16 and a 14-year-old. So
yeah,
I can totally relate to that. Like if people say it's so hard to have little babies, like it is,
it
but
is.
this nobody prepares you for this part.
So I quickly realized that I needed to model different behavior. For I had to look internally. They're just being teenagers. That is their job,
Yeah.
and they're good kids. My kids are good kids. And thank God, they look great on paper, but they're still my kids.
Yeah.
And I ended up getting therapy for the first time, really talking through like generational trauma. So
Love it.
I, started utilizing meditation and journaling, things I'd never used before, really carving out time for myself every day to just reflect and gratitude and things I was grateful for. And I have to say, hormone therapy really helped. Really, just my
When did you
mood.
start hormone therapy?
So it was 2015. So Bob died. I went off the rails
Okay.
everywhere, every which way from grief. And then it was 2016, middle of the yearish, that I put a
How
toe
old
in the
were you
water. And
then?
I was 48.
Okay. So, yeah,
And it
I think
took
a
me
lot of
about
people.
6 months to figure out I was in menopause
Yeah. And oh yeah,
myself.
I think that's a really good point. How do people figure out if they're in menopause?
So certainly if you've gone a year without a menstrual period, and you're over 45, that is the clinical definition. It's a terrible definition because
Yeah.
like me, I had PCOS. Not having a
Yeah.
period was totally normal for me. Um, what if you've had a IUD that with progestin or
Mhm.
a hysterectomy, or, you've never had regular periods? That is a
Mhm.
terrible way to diagnose it. But if you used to have regular periods and now they're gone and you're over 45, that's pretty much it. We have blood tests to say if you're postmenopausal, but in perimenopause, there's because of those wild fluctuations we talked about, we don't have a great blood test. You have to have an astute clinician who can rule out hypothyroidism, autoimmune disorders, inflammatory disorders, nutritional deficiencies, because a lot of things walk and talk like perimenopause,
Mhm.
PCOS. Um, so, it's really teasing out, what ruling out the other things. And you're like, okay, this is it. And then we start talking about therapy.
Are there people who, and I get this question, I think you're the best to answer this. What about people who are in their 40s? They're not sure where they're at with,
Mhm.
menopause or perimenopause, but they're having all the symptoms. Is it
Mhm.
appropriate for them to go to the clinician and say, hey, I want to try hormone therapy?
So I think so. And that's what I'm doing in my clinic and other people in the
Yeah.
menopause. We're making sure, ruling out the other stuff, doing
Yeah.
the appropriate blood work, not doing a lot of hormone testing because it's really not super diagnostic, sadly, but
Yeah.
validating her symptoms, believing her. Okay.
Mhm.
That's number one. And then we start talking about therapy. Now, that therapy is very different for different symptoms. So we kind of are, is she having heavy periods? Is she having this? Is she having that? We're trying to calm things down while
Yeah.
she transitions through, especially mental health. And that could be a combination progesterone, estrogen. The dose depends on what we're trying to manage. And then what works like in year one may not work in year four, may not work in year 10. It really is a lot of trial and error right now.
How do you feel about testosterone for women?
I think it's a great idea in so many cases. Our testosterone levels decline through perimenopause, from aging and from the loss of what we can produce in the ovaries. And we know clearly that women who are suffering from hypoactive sexual desire disorder will see tremendous improvement with testosterone therapy. And the data on mental health, cognitive health, muscle and bone health is very, very promising. So I am recommending it. Certainly, if she has HSDD, we're going for it.
Mhm.
Okay.
Yeah.
On top of everything else we're doing. If she has sarcopenia or osteopenia, osteoporosis, I am recommending it as adjuvant therapy to the protein intake and the muscle lifting and weight loss. And patients are just, if you keep them in physiologic range,
Yeah.
that's the problem. A lot of women are being overdosed and put into male levels. But
Right.
literally, if you just get her back to her 25-year-old level, which
Yeah.
probably was somewhere between 40, 70, maybe, she will thrive
Yeah.
beautifully.
And, okay, last question. What do you think about bioidentical hormone therapy versus the traditional?
So, estradiol, when you say body identical, just think estradiol. That's the main hormone that's produced in our ovaries. Okay. Most things are synthesized in a lab. So we take the precursor of yams and go through chemical modifications until we create progesterone, testosterone, and estradiol. So I see these synthetic labels and all this stuff. Now, there's also ethinyl estradiol, which is in most birth control pills. That
Mhm.
is, what most people would consider synthetic.
Yeah.
Primarin is very natural. It's pregnant mare urine, comes from nature. Not a big huge fan of that one because of the ethics around how they create
Yeah.
it. Also, it's an older medication. Most people in modern menopause care don't use Premarin. We use estradiol. So when I say body identical, I mean I'm going to try to give you back as close to what your ovaries used to make as possible because that's what your body's used to, and it makes the most sense to me. Um, in that body identical category is also estriol and estrone. Estriol is created in the placenta. So those of us who've been pregnant,
Yeah.
that's the main hormone in pregnancy. And then estrone is mostly created in fat cells in the periphery from aromatization of testosterone. So we have some estrone in our brain, and you can then take estrone and create estradiol, which is what the brain prefers. So, you know, all three of those are body identical. Typically in modern menopause care, we're just giving estradiol, just giving them, exactly what their ovaries is as close as we can get and what they used to make.
No, I love that explanation. And I could talk to you for hours, and I probably want to talk to you about other things, just journey and what's working for you and what's really, we'll keep the conversation going. But I want to thank
Sure.
you for taking the time on your vacation or downtime in Colorado through our heat wave camera moments. Um, want to thank you so much for being on. And I know the new menopause is available everywhere books are sold, but tell us where everybody can find more about you.
So on cross social media channels, I'm Dr. Mary Claire, and we have a website called
Okay.
thepauseLife.com that has free, God, everything free, downloadable guides, aids, how to talk to your doctor, how to find a doctor. I just try to dump all the tools and guides that I can on our website to be able to help people get their best health care.
So exciting. And I'm so excited to know what you're working on next. And is there something that you are working on next that you want to talk about?
Yeah, I'm really want to talk. My next book, we've contracted with the publisher. I want to do a deeper dive into the medicine around perimenopause. I think it's,
Love it.
when you look at PubMed and you go to pregnancy, 1.1 million articles, menopause, 97,000, perimenopause, 6,700. We have a
My
lot of
God.
work to do.
I had a doctor on, a researcher from the Salk Institute, Dr. Sachin Panda, who is like the leader in circadian medicine. And he said, now we're starting to use female mice. But we never did. And he's like, "You might be shocked, to know that female mice are just so much tightly wound to their circadian rhythms than male mice." I'm like, "No, we know that." Women, of course, like, are when you shift your wake time and sleep time and, you don't get enough sunlight or you're not getting enough sleep, like, I know that affects me more than my male counterparts, my husband, son, but it's just coming out in science now.
Yeah,
It's
I think we're just going to get blown away every day
I
now
know
that they're
it's
finally studying women.
I know it's exciting, and I'm so excited. You have 2 daughters, right?
I do. I
They're
do.
handing off the torch to these ladies,
Yeah. So,
that are
yeah.
gonna do such great work. So, thank you again for being on and taking the time out. Really, really appreciate you.
Oh, thanks for having me.